diabetes. So my topic for today's discussion is role of yoga in diabetes mellitus. This is the place where I am privileged to work, Ramakrishna Mission Sevashrama, Haridwar, located in the northern part of India. This hospital was started in the year 1901 at the behest of Swami Vivekananda by his direct disciple Swami Kalyanananda. We have 24/7 emergency ICU and a full-fledged hospital where we have got all the full-time consultants living in the campus and serving the poor and needy. This is a special picture which you are all seeing. Children with type 1 diabetes celebrating their so-called disease or a lifelong disorder. These are the unique moments for me wherein I see my children on the platform during the celebration of World Diabetes Day, where they perform colorful programs on the stage in front of all the dignitaries once in a year in our Ramakrishna Mission Sevashrama premises. Dear friends, as we know, diabetes is a chronic, preventable lifestyle disorder characterized by increased blood sugars. When it comes to types, we know type 1 diabetes, type 2 diabetes, gestational diabetes, secondary diabetes due to other diseases of the pancreas. Today, I'll try to focus on the type 1 diabetes. So when we talk about the common causes of diabetes, why the blood sugars are going up, many of the times we can get an answer. Yes, these are preventable, but there are some lifestyle disorders like physical inactivity, because of which we get central obesity, and the common stress that everybody is facing today may lead to diabetes, and that's a preventable cause. So what happens in diabetes? Why the blood sugars go up? Because of the insulin resistance. Now, can diabetes be controlled with yoga, exercise? Yes. To understand this, first of all, we should understand there is a body-mind connection. And we are not just this body and mind, but there is soul or spirit, the highest energy, which can neither be created nor destroyed. That universal energy which runs the whole universe also runs our body and mind. So when you understand there is something behind this body, we get to know few more things. The gross body which we are seeing outside, which is made up of the food that I eat. I am Swami Dayadhipananda. I have got a form and name. The external form, what you are seeing, that is called as Annamaya Kosha, the physical body. And energy required to run this body is the vital energy. So that is called as Pranamaya Kosha. Yes, I have got a body and there is some energy, vital energy, which runs this body, but there is something behind it which makes me to function. For example, I have got my hand. If you give a knife in this hand, that knife can be used either for cutting somebody's neck and harming him, or doing a surgery to save a life of a person who comes in our emergency. So what is that which makes to do sometimes good, sometimes bad? That is our mind behind this body and prana shakti, that is manomaya kosha. Once my mind is trained with right thinking, right living, my mind gets proper directions. The trained mind, which is having a capacity to think definitively, that is called as Vijnanamaya Kosha. And behind this, that energy, highest energy, universal energy, which runs everything, because of that, all these layers, all these, what I talk, Annamaya, Pranamaya, Manomaya, Vijnanamaya Kosha running is the Anandamaya Kosha. Ananda, the bliss, the eternal joy comes off out of our real nature, that is soul, spirit. If you are a believer of God, God himself is running this body. So when we understand this body, what we are seeing externally, and the diseases which are seen in this physical body also has some higher dimensions. So when we understand, then we really understand the role of integrated medicine. So when we understand, we are not this physical body and mind, Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha, we also need to attend all these. Then only we feel better. That's what integrated medicine means. And WHO also says, World Health Organization, physical, mental, social, and spiritual well-being of a person, and not just free from disease. So when we understand the definition of WHO, when we understand the 5 layers which is running this body and our body whole in a whole nutshell, then we understand when we want to address anybody for wellness, he should be addressed for Annamaya Kosha. To keep this physical body fit, one needs to do proper physical exercise, asanas, and some exercises. And to take care of the Pranamaya Kosha, which runs this body, that vital energy, we need to learn to breathe properly. That is learned through pranayamas. And by doing proper meditation, relaxation techniques, our mind gets trained. That mind which runs this, which makes this body to function. So that mind gets trained by meditation and breathing, relaxing exercises. So when we talk about Vijnanamaya Kosha, which directs this Manomaya Kosha to function in a proper way, we should take help of scriptures like Upanishads, Bhagavad Gita, and all great religious teachers. That will help us to develop our Vijnanamaya Kosha. Anandamaya Kosha, which is our real nature, that can be reached by practicing Karma Yoga, doing the work in the spirit of service, by doing good to others. That is called as Karma Yoga. Also, it can be attained by proper meditation when one reaches the state of Samadhi. So this is in brief about the different layers of our body, the layers which are behind or beyond this physical body. So when I talk about type 1 diabetes, as we all know, type 1 diabetes is an autoimmune disorder due to which our body has failed to produce insulin. So as a practicing allopathic doctor, I teach my diabetic children how to manage their blood sugars, how to take insulin according to food that they eat, how to take care of their physical, mental, social, emotional, and spiritual well-being. That's where role of yoga comes, especially in the management of type 1 diabetes. It's very unique. In the journey of 10 years at Ramakrishna Mission Haridwar, with the help of eminent doctors from India and outside India, we have developed a module by which more than 300 type 1 diabetic children are leading a healthy and happy life. So, yoga and pranayama, as I said, benefit anybody immensely for a healthy life, for being wealthy and being well. So what are these yogasanas and how they are going to help us? As I said, obesity is a very high risk for somebody to develop diabetes. And these type 1 diabetes children, if they develop obesity, they can have added complications. So yogasanas help in reducing the obesity, thereby decreasing insulin resistance. So to name few yogasanas and pranayamas, which can be practiced by everybody and especially type 1 diabetic children and any other diabetic patient are Bhastrika, Kapalbhati, Anulom Vilom, Brahmri, Udgita, Surya Namaskara, Tadasana, Trikonasana, Paschimottasana, Bhujangasana, Shavasana. So these are the few postures which can be learned from your yoga experts who is available with you. These are my type 1 diabetic children who are very well versed to take care of their blood sugars because they get proper DSME, diabetes self-management education. Along with that, we conduct monthly support group meeting in which the children, parents are taught about diabetes by expert speakers online, by local eminent people, by doing counseling. So like that, with that effort which is done by all, these children are performing. This girl is Vishika. When she came to me, she was 3-year-old. Now she is 10-year-old. She has become a yoga expert. We also conduct support group meeting and summer camps where we teach them yogasana and pranayama. What does pranayama does? As I said, pranayama helps in regulating the breathing pattern, thereby relieving the stress. So in the beginning, when I introduced stress, and if you don't know how to breathe properly, your vital energy is not being functioning properly, thereby you become a high risk candidate to develop metabolic disorders, autoimmune disorders. So why pranayama has immense benefit by practicing pranayama, our vital energy is properly distributed and we are stress free. So pranayama like Anulom Vilom, Kapalbhati. So Anulom Vilom, we can see breathe in through left nostril, breathe out through right nostril. Breathe in through right nostril and breathe out through left nostril. By doing this, our breathing is balanced. So when there is equilibrium between body and mind, we are stress-free. When we are stress-free, our hormones are in order and there is less chance of getting metabolic disorders and less chance of getting autoimmune disorders. So if one can practice the principles of treatment as taught by our own system, along with that, meditation, prayer, and yoga, we have immense health benefits. What I recommend is the treating doctor should also practice yogasana, pranayama, prayer, and meditation along with the children, especially in the support group meeting. Ramakrishna Mission Haridwar conducts every month support group meeting last Sunday, and for the last 10 years, not even a single month it has gone where we have not conducted support group meeting. Spiritual strength helps us to overcome hardships. We can take healthy decisions which are good for me and for others. That helps in to live longer. Studies have shown all these. Also, our scriptures have taught, as Bhagavad Gita, Sri Krishna teaches, even a little bit of spirituality saves one from great dangers. So, if you practice even little, we get immense benefits. The message of Swami Vivekananda, strength is life, weakness is death. So, we should learn how to become physically, mentally, socially, emotionally, and spiritually strong so that we lead a happy life by becoming fit, by being fit, healthy. What we do help others. Once I become a good person, I can help others to become good. That's what be and make. There are few pictures of the support group meeting where eminent people come and participate in our support group meeting. So with this, I thank one and all for your patient listening.